Hello there, my name is Dr. Sarah Wooten, and in this video, we are going to be talking about the topic of spaying and neutering your cats. Big topic, got lots to talk about, so let's dive in. Spaying and neutering, right? You always hear your veterinarian talking about it, and you always hear them talking about the importance of it, and then you read it on the internet. But what is really going on with spaying and neutering, and what do you need to know as a pet owner, as a cat lover, right? You want your cat to be the healthiest that they can be. You want to make the most informed decisions that you can. And one of the big decisions that you're faced with almost right away, especially if you have a new kitten, is whether to spay or neuter the cat and when. If you are adopting an older cat, chances are high that that animal has already been spayed or neutered, because most adopted animals are not released from shelters unless they are spayed or neutered. But if you have a kitten, or maybe some feral cat has adopted you, what is the best thing to do? And why do you want to do it? And when do you want to do it? And what is this all about, right? So hopefully I can demystify a couple of common questions surrounding these procedures, and then we can make a better decision at the end once we have all the information. Right? So let's talk about what's happening in an unspayed animal. Let's talk about unspayed female cats first. And these are cats that have not had a spay surgery. The main concern with them is that if a female cat is not spayed, unless she is confined and there is no chance of her getting out ever, then there is a high likelihood that she's going to get pregnant. And that she's not only going to get pregnant, she's going to get pregnant multiple times a year, because these cats go into heat, they get pregnant, they have kittens. As soon as they wean their kittens, after about 6 weeks of nursing, they will go right back into heat again. And kittens as young as 6 months of age are sexually mature and able to have kittens. And so you could have a literal kitten having kittens. And that's obviously not what we want to happen. They estimate that 70% of feline litters are unplanned because people are surprised because they're going into heat so soon, and then they just keep going back into heat, right? They are seasonally polyestrous. No, they are not polyamorous. We're not in the lifestyle here. They are seasonally polyestrous, which means that they have multiple cycles during the breeding season. The breeding season varies depending on where you live and what kind of temperature it is there and how many daylight hours you have, right? So here in the Northern Hemisphere where I live, cats usually are on their heat cycles from January to the late fall. That's a long period of time for them to get pregnant, right? Cats that live in more tropical regions, or cats that live mainly indoors, get this, they can cycle year-round. Yeah, and I don't have the numbers on how fast they can procreate, but it's pretty astounding. If you look it up on your own, you'd be astounded at how many kittens one female cat can produce. These cats are wired to reproduce, and they are good at it. Each heat cycle lasts about 6 days is when it lasts. And if an unspayed female cat does not mate with a male cat during her heat cycle, then she'll go out of heat for a very short period of time and then back in again. Cats are engineered to procreate. So that's kind of the main thing that vets are thinking when they are recommending spay and neuter to you. But there's other reasons why. So cats that are unspayed females that still have their uterus are at a much higher risk for a condition called pyometra, which is a life-threatening infection of the uterus. They are also at higher risk for uterine or ovarian cancers. And if you have ever had, then there's behavioral issues, right? If you've ever had an unspayed female cat, when they are in heat, they will do anything they can to get outside because they're biologically hardwired to go find a male cat and make kittens. And unspayed female cats are cray-cray when they are in heat. They meow, meow, meow. Sometimes they get super affectionate or super aggressive. It's just all, they're like women, right? I mean, it's crazy. It's all over the place. So there's a lot going on with that, right? So that's your girls. Let's talk about the boys now. If you've ever been around a unneutered tomcat, they have a very distinct odor about them. It's called a musk, and it is very strong. You can often smell it with like big cats that are in captivity, right? Any of those that are breeding animals at a zoo. I mean, you know, when you're walking up on those guys. Well, domestic tomcats, they're the exact same thing. They'll get really big heads. They'll get facial folds that are for fighting. They look different, and their odor has an incredible odor that most humans don't really find attractive. Furthermore, male cats are much, much, much more likely to want to roam, to look for girls, right? Fight with other males. Just a typical testosterone-driven behavior, which puts them at higher risk for abscesses and for feline immunodeficiency virus, FIV, which is pretty much the same as feline AIDS, and it's usually passed through biting and fight wounds. Also, male cats have it's a normal behavior of urine spraying. Humans don't like it because, you know, obviously we're humans and they're cats, but it's normal. It's normal for a male cat to spray urine on their territory. And if their territory includes your house, then that's what they're going to be doing, spraying stinky urine all over your house. Obviously, there's a lot of different things to think about, right? Benefits of neutering include a reduced incidence of feline asthma and gingivitis. Interesting. Also, it reduces all the other risks that are associated with roaming, such as automobile-related trauma, you know, hit by a car, dog or coyote injury. So all of these things go down when you have your cat neutered. For females, they won't have kittens, which is great. They won't go into heat and act all crazy, and they won't be at risk for uterine infections and cancer. And you, my friend, you help control feline overpopulation. So there are millions and millions and millions, like 70 million cats or something like that in the United States alone, let alone the rest of the world. And what we do know is cats are avid hunters, and they really impact their local wildlife. And unfortunately, part of the declining songbird population is due to cats hunting. In fact, songbirds make up about 25% of feral and stray cats' prey. And hunting cats are also responsible for the decline of at least 27 small mammal species. Okay, so now that we've talked about the benefits, or why veterinarians like me tend to talk to you, the pet parent, so much about this procedure, let's talk about the concerns with spay neuter, right? Because I'm sure you have certain concerns. So number one of the main concerns I hear is that it will make my cat fat. Okay, well, yeah, so most of the time, the spay or neuter procedure is done around 6 to 7 months of age. At that time, your kitten is transitioning from a kitten, fast growing, to an adult, not so fast growing, right? They're done growing. So you put in the factor that they are finishing growing and they're needing less calories overall. And then you do a procedure on them that can affect their hormones. There could be an increased risk of weight gain after this. But oftentimes what I find is it's because people have not switched their kittens over to cat food, adult cat food, and they're still feeding them as if they're a kitten when they really need to be reducing the calories in order to prevent obesity, whether it's a spayed, neutered animal or not. Okay, so yes, when you do spay neuter animal, oftentimes it does bring the metabolism down a little bit, but usually the problem is that you're just feeding too many calories. Number two, my cat will be sad because they didn't have a litter. Okay, so that is, my friends, that's anthropomorphizing. That's us taking our human sets of formed beliefs, thoughts, emotions, thought patterns, and then projecting it onto a completely different species 100%. I can tell you, cats don't care whether they have a litter or not. Now, I am not an animal communicator, and I have not had the conversation with the cats, but I can tell you that I have treated tens and tens and tens and tens and tens of thousands of cats. I'm not going to say a million cats because I don't think so. And they live wonderful, happy, long lives without having the stress and strain of carrying a litter of kittens. And the thing is remember, when you think that way, you're thinking in a microcosm, but you have to think in a macrocosm and remember that we have a cat overpopulation problem already. And so we all must do our part. And that's one way to do our part. Number 3, the surgery is dangerous and painful. Okay, yes, those are valid concerns. And if you are at all concerned about those things, talk to your veterinarian. Ask them for their anesthesia protocols. Ask them for the way they control any kind of bacteria. Ask about the sterility of their surgery room. Ask about the sterility of the surgical instruments. Ask them about postoperative pain control. Ask them about the actual procedure, right? Most veterinarians will be happy to talk to you about this because they know it's important, right? So most times, this is the most common surgery that is performed by veterinarians day in and day out. I have performed thousands and thousands and thousands of these surgeries, right? And I can tell you that in comparison to a dog spay, cat spays, way easier because everything's smaller. Cat neuter, even easier. It's one of the easiest procedures out there. It's very important that your animal, your cat, your kitten, gets pre-anesthetic blood work run. So one of the main causes of death is death due to anesthesia, not due to the surgical procedure, but something inside the cat is not working well. They don't react well with the anesthesia, and that causes an adverse surgical outcome, such as death. Right? So one way that we combat it as veterinarians, we do an extensive pre-anesthetic examination. We run pre-anesthetic blood work, which just lets us look at all of your cat's functions of their internal organs, their blood counts, their electrolytes, all of those things we can check that help us understand whether this cat will metabolize the drugs correctly and then wake up. If you have concerns, talk to your veterinarian. Know that your veterinarian, unless they are fresh, and I mean fresh out of vet school, has performed these procedures thousands and thousands of times without incident. But this is the first time for you. So it's always important that you get all the information that you need so that you can feel comfortable. Okay, I've said enough on that. Another concern that neutering male cats will predispose them to urinary problems. The main one being urinary blockage. So cats have, male cats and female cats, but we're going to talk about male cats because it's usually a problem in male cats. They have a tube that connects the bladder, that's the sac that holds the urine, to the penis. Am I allowed to say penis on YouTube? I don't know, but I just said it. That tube is called a urethra, and it's long. It's long. And in some cats, it can become very narrow, and then anything going through that tube that blocks it up keeps the flow of urine from coming out, can create a life-threatening situation. So some people, some veterinary experts postulated, they were like, why are these cats getting blocked? Because ultimately, at the end of the day, we really need to figure out why these things are happening and not just treat them when they happen. But somebody postulated, well, maybe it's neutering them that causes this tube to become narrowed. So I've heard that too, and I did some research. I can tell you that the American College of Veterinary Surgeons, they say that early neutering of cats does not cause reduction of that tube size in cats. They say it doesn't. But then Blue Pearl, which is a group of hospitals that have board certified veterinarians in them, so these are specialists, right? They say on their website that early neutering of male cats may cause the urethra to fail to develop to a normal diameter, right? So even in the veterinary world, we are not all in consensus about that. And the fun thing is that's okay because we're all learning and we're all evolving and we're all getting better. What do I have to say about this? I think that if we're neutering kittens too early, that could cause some problems with development because you've got a lot going on, right? So to be safe, unless you absolutely have to do it early, I always wait until after 6 to 7 months of age. After the cat has reached sexual maturity and has stopped growing is the best time to neuter those cats. That's my 2 cents. Take it for what it's worth to you. The other thing I would say on this is you can ask your veterinarian about the technique that they use to neuter. I might be getting myself in trouble, but that's okay. You guys need to know this information. The old way of neutering, and I learned this way when I worked in a shelter when I was a very, very young vet, and I was taught by, I think he was 70 at the time, and that was like 20 years ago. So I don't even know if he's still alive yet, but God bless him. He was a very old veterinarian. And since I was just at the shelter to just do surgery, his nickname for me was Slash. A little extra story for you. And he'd come in and he'd have his pants up to here and he'd go, "How's it going today, Slash?" So anyways, all that to say, he did show me a very speedy technique that was a very old technique that required some pulling. That is not a typical technique that's used nowadays. The typical technique is called a self-tie technique, where we tie it on itself and heals up very, very quickly. So ask your veterinarian if they use the self-tie technique for neutering, because I do feel like all that pulling could cause some trauma, which could cause some scarring and some strictures. But again, conjecture on my part. I'm just sharing you what I think inside my head. So that's all I have to say on that. The last concern that is some people share with neutering kittens is that early neuter can predispose them to an orthopedic problem called capital physis fracture or slipping. So this one actually has some truth. So physis is just the fancy medical term for the growth plate, the bone growth plate, how the bone grows. And the capital physis is at the head of the femur. So you have your cat's pelvis and their leg, and at the top of the leg where it joins up with the pelvis is where the capital physis is. And they have found that some kittens, especially overweight kittens, can be predisposed to a fracture of that part of their leg if they're neutered too early. So we don't want to be neutering kittens before they're done growing, if at all possible. So wait until 6 months, 6 to 7 months of age to spay or neuter your cat, unless you have severe behavioral problems such as urine marking or fighting or something like that that indicate an earlier need for neutering. Bottom line, talk to your vet. There are a lot of different things to think about when it comes to spay and neuter. I recommend waiting until your kitten is done growing, and that's generally around 6 to 7 to 8 months of age. Wait till they're done growing, make sure you feel comfortable with your surgeon, and then lastly, make sure you're controlling those calories after you have them spay neutered. And then to reduce the incidence of any kind of post-surgical complications, right, after the cat comes home, follow all your discharge instructions to the letter. That cat needs to not be moving around a lot, because if they move a lot on an incision, that incision has a lot of motion and it can't heal. It can't heal because it needs to stay still. Furthermore, that can create additional inflammation. It can cause sutures to pop out. It can cause incisions to open up. It can cause bleeding. If we don't control the licking of the surgical sites, it can cause infection at that area. So it's really important for you to check your cat daily for the week following surgery for any signs of problems with the incision site, including redness, odor, discharge, swelling, pain. All of those things indicate an issue. Call your vet. Ultimately, you are in the driver's seat of your pet's health. These decisions are yours to make, not your veterinarian's. They're not mine to make. These are your decisions. So I feel like now you have the information that you need so that you can make an informed decision for the health of your pet. Thank you so much for watching. I am here on YouTube a lot with a lot of different health topics for cats. And so if you like this video, give me a shout out in the comment section or share it with your friends. You can also leave me comments about what you'd like me to cover. And you can hit subscribe because this is fantastic. We love talking about these health topics. And maybe, just maybe, something that you learn on one of these videos might save your cat's life. So thank you so much for watching. I am Dr. Sarah Wooten, and I'll be back with more health topics in the future.